BBC Radio Merseyside.
So as we've been saying this morning, Cheshire and Merseyside alone, over 200,000 people smoke, and it's still the single biggest cause of preventable ill health and death. Well, this week sees the start of Stoptober, a national campaign to encourage smokers to quit. Well, Debbie Watson is the Director of Public Health for Warrington and joins me on the line now. Morning, Debbie.
Morning, Kevin.
Thanks for joining us this morning. So I've just touched on it a little bit there, but let's do a deeper dive, I think, Debbie. How big a problem is smoking to the health of those in our area?
So thank you, Kevin, and thanks for having me on this morning. So as you've said, in Cheshire and Merseyside, 2 in 3 of the people that you've talked about, though, that those over 200,000 people will die too soon due to smoking, and many others experience illnesses and disability as they get to middle age. But it's not just about those numbers, it's about the impact that smoking causes for our residents and their families. You know, it causes cancer, heart disease, lung problems. We all know around the harms, but also, you know, it harms the person who smokes, but it affects everybody around them, really. I think, you know, some of the experience of your listeners there, I've just been listening, you know, tells us that it affects everybody, you know, around them, especially families, communities, children, even pets, you know. So that's why it's so important for us to really push Stoptober as a way to say, let's quit smoking together. And it's a way that myself and other directors of public health want to show your listeners and everybody in the region just how many different ways there are to get help locally, whether, you know, you're trying to quit for the first time or for the second or even the 10th time. It's never too late.
Yeah, never too late is a great point there, Debbie. I mean, we know the damage to health is widely known. We know that. But that smoking causes many problems. But I guess, you know, there's the cost of the cigarettes, which is sky high as well. So, you know, with the cost of living crisis that we're in at the moment, you know, the implications on our health. Why do you think people still smoke?
Well, you know, people still smoke, Kevin, for lots of reasons. And many people started when they were young. You know, we've just heard that, before they really understood the risks. And once you're hooked, it's really hard to stop. You know, as people have said, nicotine is incredibly addictive. And some people smoke to cope with stress or anxiety or difficult life situations. Others might be surrounded by smoking in the family or the community, so it feels normal for them. And that's why, you know, through this campaign, we're not judging. We understand it's really tough. And our job as directors of public health really is to offer that support, not blame. And Stoptober's really is about giving people the tools and the encouragement to make a change, but when they're ready.
You know, I've spoken so many times about vaping and I've interviewed lots and lots of people just, you know, about vaping and how it was introduced. You know, it was introduced to wean people off tobacco, to wean people off from smoking. But it seems to me that people are going straight to vaping and cutting the tobacco out. So the question's got to be, you know, can vaping really help people quit smoking cigarettes?
Okay, it's Stoptober is about helping people to stop smoking, and it is important for us to continue our efforts to reduce smoking rates, because we've just talked about, haven't we, the unique dangers of cigarettes. Local services can help people to stop smoking using vapes, but there are lots of other measures as well to support people to stop, including nicotine replacement therapy and other medications. So, and local services can also help people to stop vaping, and national measures like the Tobacco and Vapes Bill will also help us, because those will have measures in them to make vapes less attractive to young people. So in answer to your question, Kevin, I think vapes can be a useful tool in helping adult smokers to quit, but they should never be used by young people or those who don't smoke. You know, if you don't smoke, don't vape. That's the message.
Yeah, and that's the dilemma, isn't it? That's what we've been finding, is that companies who have been targeting our young adults to encourage them to vape, you know, with all of the sweet smells and all of the aromas and all of that. They portray that it's not going to be harmful, but, you know, Should we be doing more, Debbie, to make sure that, our kids are safe from vaping?
Yeah, absolutely. Hopefully in the future we won't need Stoptober because people won't start smoking in the first place. And the key thing here, Kevin, is the Tobacco and Vapes Bill, which is currently going through Parliament. Yeah. And that aims to do that by progressively raising the age of sale for cigarettes. But what it also does is it cracks down on youth vaping by banning these child-friendly packaging, advertising, free samples. There is absolutely no way that our young people, we want them to become trapped in a life of addiction, either through vapes or through cigarettes.
Yeah, and the financial strains that will happen on as well. It's a ripple effect. Just for anybody listening then, Debbie, what advice would you give to anyone who's in that bubble where they really do want to quit, but they just haven't found the strength to do it?
Yeah, so there's lots of free support available across Cheshire and Merseyside. So, Smoking Ends Here is our project across the region to encourage people to stop smoking. And it really does point them towards local support. And to find out more and hear from other people, it's always good, I think, to think about looking at other people who have successfully quit. But you know what? It's never too late. I said that at the beginning. And for most people, it takes multiple attempts to quit smoking for good. My parents, both smokers, born in the 40s, smoked till they were 60, and actually tried to give up a number of times. And in the end, it was about cost. That's what motivated them to quit. But actually, there is lots of support available, online advice, one-to-one support, access to tools that we've talked about, like NRT, vapes and medication. But for more information and to contact your local service to get that information, Kevin, if people could visit www.smokingendshere.com, all the information that you'll need will be there.
That's brilliant, Debbie. It's been lovely having you on the show today, and you've just really started this whole hour off the way I wanted it to start off, by sending a strong message, that smoking stops right now and you can do it. There is support out there for you. So thank you for that powerful message. Really appreciate that. Thanks, Debbie.
Thank you, Kevin.
Yeah, all the best. Debbie Watson, Director of Public Health